We're going to go ahead and get started, and people will continue to come in, and we welcome you, but we want to have plenty of time for our presentation and questions. So I am Patty Koval, the Director of Member Engagement and Learning for VFN, and we appreciate you all being here today and learning more about this great opportunity. When Annalise and Kathy came to VFN in the spring to tell us that this was a possibility, we were really excited because we've had, since day one, especially since the first conference in Williamsburg, we've had a lot of people who have been interested in youth mental health. So this is another opportunity for us to potentially do some work together, or for you all to be engaged individually, even in your community. So with that, I'm going to turn it over to Kathy Spangler.
Thanks, Patty, and good afternoon, everyone. I'm Kathy Spangler, and I'm the director of Serve Virginia. Serve Virginia is a partnership between the Virginia Service Commission, located at the Virginia Department of Social Services, so state government, and the Virginia Service Foundation, which is a 501c3 nonprofit that is dedicated to supporting our state service plan. And we are members of VFN, so we're really excited to be with you today to share this information. In addition to overseeing the well-being of service and volunteerism across the Commonwealth, Serve Virginia administers the AmeriCorps state and national programs, which is AmeriCorps members serving in a variety of ways to address key issues and challenges that communities face. Our annual impact of AmeriCorps in Virginia is not insignificant. It's almost just over $19 million in terms of AmeriCorps and local funding that is leveraged to support Virginians across key areas such as health and education, economic opportunity, environmental stewardship. And we have relatively on an annual basis, over 3,000 members who are serving in communities throughout the Commonwealth. And this year alone, we're located in 363 service sites across the Commonwealth. And so that's a bit of a backdrop. One of the things that we learned when we did our assessment in getting ready for this spring's conference was the Virginia Funders Network has contributed over $500,000 in match funding to the AmeriCorps grantees that are serving in communities. So many of you are very involved in making sure that those federal dollars are leveraged and you provide the match to support those members in the field getting the work done. And so it's in that context that we're really excited to talk today about a new initiative that we'll explain in a minute that is focused on youth mental health. And Annalise Gamble is our statewide engagement officer, and she was instrumental in applying and winning a grant for Virginia. And I'd really like to turn it over to her to talk about how we're working to establish a youth mental health corps in Virginia.
Great. Thanks so much, Kathy. Hi, everyone. It's great to be with you all today, talking a little bit more about AmeriCorps and about the Youth Mental Health Corps specifically. So like Kathy mentioned, there's over $500,000 that is invested at the community level that goes to support these programs. So when we think about this $19.6 million, we're really proud to stand alongside you all in making this program a reality. So at the beginning of 2024, gosh, it feels like a whirlwind, there was a national challenge that was put forth by 3 funders that came together. Seeing the opportunities, AmeriCorps has long been a solution for communities interested in addressing critical needs, finding ways to bring together Americans in service to others, and using these resources to help leverage and make a strong community impact. So with this history behind us and a growing crisis in youth mental health, 3 funders, the Schultz Family Foundation, America Forward, and Pinterest came together and issued a challenge to states to consider how they might design a youth mental health corps in service of young Americans. So thinking about how can we address the needs of youth, specifically relating to mental health, by engaging folks in service and volunteerism. So Virginia was one of 11 states that was awarded funding to help design a youth mental health core model. And I'll talk a little bit more about what that looks like. But really, we're looking at a way to engage folks in service to others to address a critical community need. Again, the heart of what AmeriCorps does, but really looking to leverage this towards youth mental health. I'll send out, or I'll work with Patty to send out some more links in the follow-up information, but just knowing that this is really a national movement that Virginia is a leader in is really exciting. The charge was clear. We wanted to design a national service program that engaged young adults, so kind of that 18 to 24 age range, and service opportunities to address the mental health needs of youth, age 13 to 18. This is not only to meet critical community needs of youth in today's in Virginia, across Virginia, but also really thinking about how we can use this as a way to develop a workforce, kind of create a talent pipeline through service so that folks are not only gaining that exposure and experience through their service experiences, but then also using those as a way to stack and combine different experiences to actually walk away with credentials and certifications, building that next generation of mental health professionals in the state. We think that this is a really engaging way to not only engage folks in the needed training and technical pieces of getting certified to become mental health professionals, but this really does so in a way that meets immediate needs and also gives them a wide variety of experiences that they can take with them to become kind of better prepared to engage in the workforce later on. The initial parts of our work have really been around thinking about how to leverage service and workforce development in service of youth mental health. So we've been engaging with partners across state government, from the First Lady's office and the Governor's administration to other state agencies like the Department of Ed and the Department of Behavioral Health and Developmental Services, really thinking about how does this come as a additive and enhancing process. We also have been connecting with folks in communities across Virginia, really thinking about how this aligns and supports workforce development overall. We know that youth mental health has been a long time focus for a lot of us. And so we don't want this to come in as an external program that seeks to just add something else to the conversation. We really think about this in a co-investment kind of model. And so thinking about how do we come together with all the initiatives and programs that we're supporting, thinking about this as a way to help get boots on the ground and support folks in their workforce development journeys, specifically in service of youth mental health. The program model that we are looking to develop as a part of this, in partnership with community organizations, with higher education institutions, with state agencies, with funders, with partners like you, has three kind of pathways within it. So first, the first two, there are AmeriCorps models already that look at focusing on kind of training and supporting folks in their certification process. So the hours that are required for some of these certifications are included in an AmeriCorps program model. And then as folks kind of complete their term of service, as they are in service to others in their community, they're completing the necessary trainings and requirements to earn their credential in a specific field. So we have programs in Richmond, Nelson County, Danville, Pennsylvania County that focus on training community health workers as resources for their community. These folks get their initial training, they're supervised by licensed community health workers or certified community health workers. And then at the end of their term of service, have done all of the necessary experience to take the exam and become credentialed as community health workers in their space. Similar with peer recovery specialists. There's an amazing program here in Virginia called the Virginia Recovery Corps that uses AmeriCorps resources to help provide resources and support for individuals that are receiving their training and necessary experience or hours in peer recovery to then become trained and certified as peer recovery specialists. Both of these certifications then open up a variety of different jobs and careers later on down the road in community health and peer recovery. So thinking about this as a way to help connect folks that may not have come into these fields through a traditional education pathway, but really getting them that exposure and experience that helps put them on the track to either complete their credential as a part of their term of service or building to kind of other pieces. So using the peer recovery specialist as a way to then maybe start to accumulate the experience that they need to apply for a master's program in social work or something like that down the road. Another focus of this AmeriCorps model that we're developing is really focusing on school-based mental health. So we know that youth ages 13 to 18 are easy to find in schools. And so thinking about a way to help bring together these resources, right? This model of national service to meet critical community needs, bringing in what we know about the workforce shortage in the youth mental health space, and finding a way to leverage those to meet needs now and also meet needs in the long term by developing a talent pipeline and a workforce that can then kind of start to address that systemic challenge around getting folks the resources that they need to thrive in the space. We're working really closely with experts across the state, thinking about what credentials are most helpful here across all three of those pathways, and also specifically in the school-based model. We're thinking about the different training, credential, and credit opportunities that members are going to receive. All AmeriCorps members, and specifically the members that will serve in the Youth Mental Health Corps, receive a living allowance. So members receive a stipend or a biweekly amount that they can use to cover their living expenses while they're active in service. They also receive an education award at the end of their term of service. So this is an amount of money that they can use to pay for more higher education, pay off student loans, or to cover a training program. So if they want to pursue a credential that maybe wasn't included in their training or their service, they can do that with their education award as well. And then members also, depending on if they're serving full-time or not, can also be eligible for other benefits like health insurance and things like that. We are currently kind of out in the space thinking about how this works alongside similar initiatives. So how can this co-pilot with other projects? And then also thinking about learning from the workforce development space, right? What other models that take this approach have seen and learned throughout this journey. We really hope that this is something that can go to enhance and expand existing work. And so Kathy will kind of talk about ways that we want to engage you and invite your participation, and really looking to kind of co-invest with what's working in communities. And then also thinking about how we can use this to really develop pipelines. We want to make sure that this is a great opportunity to, kind of meet youth where they are, but then also thinking about ways that we can use this to develop a stronger pipeline for folks that might not come to these career fields or these jobs in other ways. And so really looking at this as an opportunity to help, widen who's in the room and who kind of can benefit from that exposure and introductory experience to then kind of participate in later opportunities down the road. So I'm going to pause here and stop sharing my slides. We are really lucky here in Virginia that there is a really healthy environment of folks that have been thinking about workforce development and opportunities to, dig into how we can use service in creative ways to give folks, to meet critical community needs and give folks those introductory experiences. And so first I'd like to introduce Dr. Bill Hazel from Claude Moore to share a little bit more about the Claude Moore experience, or what Claude Moore has experienced from supporting workforce development initiatives and specifically using this talent pipeline approach. So Dr. Hazel, I'll pass it over to you.
Thank you, Annalise. Appreciate that. And hello to everyone. Thank you for being on. I don't think we probably need to go into the workforce shortage in behavioral health or the extent of the crisis, but what I think Annalise would like us to do is to or me to do is to think a little bit, or to share with you some of the work that Claude Moore has funded and supported over the last few years. Most of you probably already are familiar with the fact that Claude Moore has been interested in getting young people into meaningful careers in healthcare, with the idea that there is a future there and there's an opportunity for family sustaining wages going forward in these various healthcare fields. To that extent, back since starting as early as 2006, they began funding in career and technical ed in high school, and then some in the community college world. And when I came in 2020, we took an inventory of what was working and where we thought the program could be strengthened. And we did learn a few things. And one thing is that we learned is that the education system, the education training system, doesn't always align very well as you go from place to place, from high school to community college to a four-year degree. And we need to smooth those transitions out. Another thing that we learned is that the credentials don't always stack, and that there are many barriers to getting those credentials. And I can tell you, for instance, in the behavioral health space, we have made efforts to fund in Petersburg around the school system there for the DOE-approved mental health curriculum, hoping to get people in, working at the state hospital for clinical experience. we've worked with the Rappahannock Community College and the Germanna CSB to create a new program called Behavioral Health Technician 1. They're just starting their third cohort now. These people are completing, or actually there, it's a program where they are actually working at the Community Service Board while they are getting their certificate from Germanna Community College. That is going to be replicated, we believe, at least 3 or 4 other community colleges and CSBs over the next year. So we're pleased about that. The key here is that we're trying to build the pathways and build the connectivity. And what we think that this is an opportunity to do, at least I think it's an opportunity to do, is one is to really engage more younger people in this. Now, whether it's the behavioral health technician, which now has been recognized by the General Assembly and actually ongoing through Medicaid, is a fee setting process right now. So these people will be incorporated into the care team going forward. The idea is to have behavioral health technician 1, 2, and then those convert to academic credit for prior learning going forward. So we think, in our mind, this or a similar model is really a great opportunity for us to think about how we can grow the workforce and get people into careers. Now, questions will come up is, what can they do in the K-12 space, particularly in high school, as we deal with near peers, defining the work that can be done. There are some other groups, like there's a group at UVA in psychology that Dr. Wolf or Dr. Mike Lyons has put together that is looking at after school time. So I think there are different ways that we can interact going forward. And then, of course, working through the community college system that is everywhere, it could be one option for delivering some of the didactics if that was chosen. So there's a lot we could think about here, and I look forward to the conversation. Hope, Annalise, that covers some of it anyway.
That's perfect. Thank you so much, Dr. Hazel. And I think that one thing that I would really touch on is AmeriCorps resources and the Youth Mental Health Corps hope to make these things, like you were saying about this connective tissue, right? Make it possible to help support folks in that interim. And so thinking about how we can enhance and expand programming in these in-between spaces and really kind of help support a lot of folks, are interested in these kinds of opportunities and then just need that support, the support and resources to make it a possibility or make it practical for their, to be able to balance, right? Their different needs and requirements. And so Youth Mental Health Corps and the opportunity to use and leverage AmeriCorps resources kind of helps make it a possibility. I'd also like to invite Andy Johnson from the PATH Foundation to share a little bit more about why youth mental health is a priority for PATH and kind of their experience from joining in on collaborative funding strategies.
All right. Thanks, Annalise. And I'll probably focus most of my energy on the latter because sort of like Bill said, some of this stuff we're really well aware of. I'm not getting into data about the youth mental health crisis. We have all heard it. We know what's going on. We know the challenges that we face at PATH. Long before the crisis became so publicized, mental health, substance use was one of our 4 priority areas. Childhood wellness, one of our 4 priority areas. So it just makes sense for us to be working in this space. We've focused a lot of attention on youth mental health first aid, working closely with one of our partner mental health nonprofits to get, several thousand people trained in our communities, in a small footprint of Fauquier, Rappahannock, and Culpeper counties. On the collaboration piece, I might be preaching to the choir to some folks here, but after the report from the Community Foundation for Northern Virginia, after reports on workforce from Debbie Oswald's team at the Virginia Healthcare Foundation, all of us in the foundation world, we're looking at these challenges and trying to find a way to come together to address it. Come together for foundations is tricky sometimes with footprints, but come on, is this not covering everybody's footprint? We can figure out strategies to work together on this and have a larger impact statewide. And we focused a lot of great energy on getting REACH training out to private medical providers, physicians, DOs, nurse practitioners, physician's assistants, to get this REACH training, which gives an intensive behavioral health training to prescribers and primary care providers. 3-day intensive training. So, for that, 19 foundations, including a number on this call, on this Zoom, came together, raised $170,000 in pretty short order, and now we have over 100 people trained and in communities throughout Virginia. I think everybody's footprint's been touched by this that got involved, and it's just a great example, a great illustration how we can come together. I think Patty and Bess and the team at VFM was saying they're hearing others talk about how can we come together? What else can we come together around? And some of them are asking about mental health. Well, when you look at these possibilities for collaboration, this gets, more direct service help out there, depending on what we, arrive at, but it's going to get more direct service help out there, and it's going to help with these workforce gaps we're experiencing. They're tremendous, from whether it's CHWs to bachelor's level social workers, right up through psychiatrists. We've got major gaps, and this is one way to address the workforce development issues too. So I think collaboration is probably the only way we're going to make a huge impact on this. So I hope that kind of answers the question there, Annalise. And I'm glad to answer others or talk further about some of this.
It does. Yeah, I think that's perfect. I think that it's such a good reminder. So many of us work in collaboration kind of in different ways, specifically in our communities. And I think that this opportunity is a unique one to come together across the state to help our communities, right? And so it's a different, maybe different type of collaboration. But I think that you painted a really beautiful picture as to what we can get done when we all come together. So thank you both. Thank you to Dr. Hazel and to Andy for sharing a little bit more from your experiences and your perspectives. I'd like to open it up just to to anybody on the call. I see Angie's invited folks to drop questions into the chat, or if folks want to kind of unmute and ask questions. I'd love to just have some conversation during this time of, what would you hope to see out of a program like this? Where do you see work like this happening, kind of on the ground in your communities? We're going to share some more kind of tangible invitations to get involved, but would really love to kind of hear from folks about sort of when you think about youth mental health, either what's motivating you to come to a call like this, and or how do you see this model really having potential for impact in your community? I'll kind of give folks a second. If anybody wants to unmute. Yeah, go ahead, Kenny.
So I'm not really youth. But I'm like in the middle of youth and not youth. But as someone who's never really had someone to kind of help me understand mental health and experience like how to get better and improve my mental health when I was younger, I think this is a really great opportunity because from what I see, society says that younger folks are weak and complain too much because of their mental health. So to see that there's a program like this that is not blaming them for their issues, but more so helping them and finding ways to help them be able to express themselves and their mental health so that they are taken more seriously is very important to me, and it really touches my heart. Because not a lot of people have had that opportunity as adults when they were 18 and younger. So I think this would be a really great opportunity. I hope I can be able to help in some way. And yeah, I look forward to seeing how it grows and how it changes many young kids' lives.
Yeah, thanks so much, Kendi. I appreciate you sharing that. For folks wanted to highlight in the chat, so Kendi is serving as an AmeriCorps Vista with the Virginia Funders Network, and so she's an AmeriCorps member herself, kind of actively engaged in helping to build capacity for organizations like yours and for Virginia Funders Network as they grow and think about how to help connect partner networks across the state. And I think that, Kendi, you bring up a great point where oftentimes near peers or kind of the folks that don't maybe aren't in that 13 to 18 age group are most well suited to see the needs and be able to speak into that. And so we're really excited by the way that this model has potential to be that connective tissue, right, between the folks that are in it, right, are currently experiencing the crisis, and then also the folks that have the most potential to join in, right, and be the solution. And so we're really excited to be able to engage folks around this kind of shared experience and think about how this can really bring capacity to organizations, to after school settings, to different folks that are interested in doing this work and just kind of need that extra capacity to get started. Thanks so much. Any other thoughts, questions, comments about work you're seeing in youth mental health, or what work that you'd love to see in the youth mental health space?
You know, Annalise, I'll just add that Kendi's comments in here just remind me, you know, the importance of getting that youth voice engaged in this early on is you know, trying to figure out direction. I really, sometimes, you know, they just add so much to, you know, I'm a 63-year-old guy here, you know, I think I got to hear from the kids about, you know, what the issues are, what the needs are, and, you know, help together find a solution. So I just encourage us on that to get the youth voice kind of formally engaged in this process.
Yeah, that's a great point. We're partnering with the Youth Advisory Council out of the Virginia Department of Health to do that exact kind of process
Right.
of trying to even think through, you know, what is an engaging service experience look like for a 18 to 24-year-old, and thinking about how this can be supportive and interesting. Something that didn't occur to me as somebody who, you know, is also not in that age group was around the interest in speeding into policy. And so after kind of consulting with some of their youth advisors and really hearing that there's a strong interest by Gen Z and youth today in kind of being able to speak into policy development, we're considering how that's going to be part of the youth mental health core experience for members, how we can encourage them to participate in processes that can develop youth mental health policies and practices in localities and across the state moving forward. And that was a direct result of youth voice kind of speaking into that need. I think
Right.
it's something great to highlight.
Um,
Yeah, Patty.
Annalise, I'm curious, and because I know you all have already had conversations with other both funders and providers and different groups around the state already. Are you seeing any particular components of the program being lifted up as the most popular, or seeming where people feel like the most traction might be able to be made?
Yeah, that's a great question. I would say, one, if you're already funding programs that are training community health workers or, you know, supporting peer recovery specialists, we'd love to be in touch, because I think that AmeriCorps resources are a great way to expand a program. So if you're currently, you know, looking at a program that maybe is engaging 10 to 15 people or wants to engage a younger audience, you know, there's definitely traction there around thinking about how does this help support, you know, getting either a new generation of folks involved, or kind of thinking about growing and replicating existing programming that are existing programming that's having an impact. We're also seeing a lot of traction in kind of the school-based space. So Dr. Hazel mentioned there's a lot to navigate. There's a lot of requirements and different pieces that make working in a school potentially a little more challenging to navigate. But we're really looking forward to doing this at a system level. So being able to get that buy-in from district leaders, from the State Department of Education, to really help support local schools, so that when local schools, or if local schools are interested in implementing this, that they don't necessarily have to also educate everybody downstream from that or upstream from them as well, that we're helping to really lay a foundation. And so in some ways it makes replication across localities more practical or easier, because there's a way to kind of think about how this can be done. It's practical, it's a possibility, and then it's just about if folks are interested in actually making it happen. And so I think that there's been a lot of traction and conversations about what the service will actually look like, and how we can get kind of larger system buy-in so that it's easy to replicate on the local level.
And you might mention, Annalise, we already have experience with being in the school. We have a fairly large statewide program with the Virginia College Advising Corps. So Annalise, you want to mention that? Because we want to build on what's already out there. We're not necessarily looking at a completely new program stream that may come of this. It may be where we land in certain regions, but in other locations, there are programs that this can be an enhancement to.
Yeah, that's a great point, Kathy. And so we have members, almost 300 members this year that are serving in school systems. So they're serving as college advisors in high schools. They're serving as reading tutors in elementary schools. And so we've been able to help our AmeriCorps programs navigate a lot of the rules and regulations of serving in a school system. And so we're really excited to find new ways to kind of adapt those models to include more social and emotional learning, include more topics specifically based around youth mental health and mental health in general. So we're excited to see the ways those programs can grow and continue to evolve. Dr. Hazel. Oh, you're muted.
Maybe better if I'm muted, but I think when we spoke, Annalise, I think a couple points here might help the group. Number one is that you do have funding and you will have something going next year, whether additional grant fundings come or not, is what I've heard.
Yep.
Correct me if I'm wrong. So it's coming and you're going to do this. Number two, that you're going to have a certain number of people that likely to be supported. And I can't remember without my notes how many people you think you're going to have.
Yeah, I think it's a great point. So we're hoping to launch September of 2025 with 75 members.
75 members. So the challenge that you're facing is that you're going to likely have at least 75 people in this 18 to 25-year-old group that will be looking for opportunities to earn and learn. You provide the earning, you provide some of the support for the learning. And what I gather you're asking us is, one is, do we know places where this can happen? It doesn't need to be one size fits all, if I understand correctly. So who can we get you in touch with that would be helpful? And then how do we think about how this sustains? But you do have sustainable funding that comes from the federal aspect is part of it, at least as long as you're in the program, correct?
Yes, absolutely. And so there's going to be two different kind of funding mechanisms for this program. The main one is going to be the AmeriCorps resources that our office helps facilitate. We are the pass-through entity for the federal AmeriCorps funding. And so AmeriCorps is one of the primary engines to this model. The other source of support is going to be around the Youth Mental Health Corps funding nationally. And so depending on kind of different pieces around our model, we will be looking into how national, state, not state federal funds, state government funds, local funding, how this all comes together to help support and leverage some of those AmeriCorps resources as well. And actually, I think this is a perfect transition point. I'll invite Kathy to talk a little bit more about the next steps in the planning process.
And I was going to.
Yeah, please, Nadine.
No, I was just going to mention that Cameron Foundation is certainly very excited about the opportunity. So one way that we see we can really dip our toe in is by promoting it to peers within our region. So we're going to host, hopefully in person, but certainly virtual if necessary, as many of our community partners, school-based health centers, clinics, whomever might have this health department to just come together, provide them this same level of information and sort of jumpstart hopefully some collaborative opportunities, but and at the same time, service opportunities in the long run. So we're really promoting it. Awareness is the first step, just like this. And that's a pretty low-hanging fruit for our foundation to be able to facilitate that and make people aware that this opportunity is out there.
Absolutely. Thanks so much, Nadine.
That's great. So there are a few ways, and Nadine, you just offered one, so I'm grateful for that. We are going to be operational. Our target is 75 members. This will be funded through AmeriCorps. We will apply back to the Schultz Foundation and Pinterest for operational support as well, which will specifically provide enhancements for the members, and so incentives that make the experience richer, the training that supports their credentialing pathways. So, the things that we need right now and would welcome your support and engagement around is to promote that this is coming, that we are planning for it. We really wanted to get to you early so that you'd be upfront in looking at this from your footprint's perspective, potentially from a collective impact perspective, statewide, and to give us your thought leadership. So certainly your engagement, we want to know who among you is willing to get involved in helping frame, design, promote the Youth Mental Health Corps as it's in development. So early stages, not necessarily down the road when we're recruiting members to serve. We need your thought leadership. And for those of you who would like to help shape this initiative, we need to know who you are. So please let us know who's interested in joining us in this planning effort to design a youth mental health corps that will work in your region and statewide. I think, Nadine, you said it, it's either a referral or a connection or facilitating a presentation to your grantees and the nonprofits that are in your region that could potentially be AmeriCorps grantees that could manage a youth mental health corps program. We want to be in touch with them early. The cycle for learning how to be an AmeriCorps grantee is one that takes some effort. And so we want to identify and get early interest. Our RFA will drop late January, early February for the funding that will take place, that will be enacted September 25 with this program. And so identifying organizations now that are either doing already or are prime and want to be doing this work around youth mental health, we'd love to have your guidance and counsel on that. It's critical that we get them ready to put viable applications in for consideration. And then I think the third thing, and I don't like to do more than three, the third thing I'd really encourage and ask for your consideration around is your thought leadership around not just launching a youth mental health corps in Virginia, but how do we scale it? How do we ensure that it's going to have the kind of long-range, long-term impact? And that, is being in the right places, having the right support systems for the members, having the sustainable funding in place, whether that's federal, potentially state, and philanthropic. So we would love to have a few of you be thoughtful with us about looking longer than designing the program for implementation in 25, but really being strategic about what is the long-term arc of a program like this, what is it can actually have an impact around, and how do we come together through the Virginia Funders Network perspective to really drive that strategy and influence state leadership and leverage those federal dollars to have the kind of impact that we would like. So those are our three asks at this point. We're in the phase where we're meeting with folks. We're processing the potential for credentialing. We're identifying potential grantees that would be sites for AmeriCorps in the field. We're talking to you because you're so passionate about this. We're thrilled that so many of you are already leading in this space. We are a partner in the process. We're going to be the grantor as we phase into that process, but we're facilitating in this phase, bringing the right folks together. And it's really your thought leadership, your sight lines in the field, in your regions, and your expertise around the subject matter that we want to draw on to leverage national service and the AmeriCorps resource here in Virginia.
Thanks so much, Kathy. And I would also just follow up to say, if this has you interested, if you're interested in the youth mental health course specifically, if you're interested in kind of the funders' role in this, we're going to be having a follow-up conversation with representatives from the national funders that came together to start the Youth Mental Health Corps initiative nationally. So that opportunity is going to be August 19th. And I think Angie or Patty is going to throw the information and the link to register in the chat. And that's going to be with representatives from that initial core, so the Schultz Family Foundation, America Forward, and Pinterest. And so we're really excited to be able to hold some space for that. They're specifically coming to meet with Virginia funders and learn more about kind of the interest here in Virginia and share their experience in this space. And so excited to be able to host that for some follow-up from this call as well.
Yeah,
And
I
so I
think,
just want
Annalise, I would say, and the other piece to why it's important, I think, to have their voice is why they chose AmeriCorps
to.
to help launch a nationwide youth mental health strategy. And so I think from your perspective as funders, it will be very interesting to hear their thought process and how they came around seeing how national service and AmeriCorps might be a viable pathway here.
Absolutely. Yeah. Thanks for that, Kathy. So with that, I talk fast, so that gives us all a little bit more of our afternoon back.
Annalise, I
Oh yeah,
think
please.
I thought Sally Dunn had her hand up a minute ago, or maybe not. I apologize. That may have been just my computer screen.
No worries. It's a great plug. If anybody has any follow-up questions, comments, you want to learn more, I'd be happy.
Lisa Bender does.
Please, yeah. Definitely not try to rush us out.
Muted, Lisa.
If for some reason you can't, you can also drop it in the chat and we could pick it up from there.
Yeah. Hez, do you want to go ahead and ask your question while Lisa's working on her?
Sure. Hi, everyone. Thanks so much for the presentation. This is really exciting. As a person who was an AmeriCorps member and also who led a nonprofit that over 4 years hired AmeriCorps members, and it was critical to our work and had amazing experiences. This is super exciting. One of the areas in which Laughing Gull Foundation supports is mental health around LGBTQ youth, as well as youth of color around mental health needs, particularly at this time, given what's going on in the South around LGBTQ issues, as well as around diversity in education. One of my questions was just, it's a lot to hold. And there's actually, Kaiser just came out with some new information about 988 and how there's a lot of drop calls on the LGBTQ line. So there's a lot here. And I'm just wondering how you all are thinking in your training and in your work, how you're supporting providers to be able to then, be able to provide that support to young people, as well as the AmeriCorps members. So I know that's a big question and this might not be the appropriate time for that, but I just wanted to note it as, first of all, the excitement about this, but also, and thanks for sharing. And then also just, it's a question that I have, and that may be for later.
No, it's a great question. And I think that there's so many, it applies to so many specific pathways, right? So our goal with the Youth Mental Health Core model is that we'll build a model broad enough that folks can find themselves within it. And that also each program is going to have its specific focus area or specific ways that the program seeks to kind of address youth mental health. Because, with youth mental health being such a huge umbrella, there's lots of different ways that we know folks across communities are kind of acting in this space. And so wanting to make sure that the model is specific enough to have a very concerted impact, but also that there's enough space that folks can come in and say, hey, I'm really interested in addressing this group of kids or this, specific population need or something like that. And so, so yes to all of the above. We're really looking to work with organizations that are, focused very specifically or focused broadly, and really helping to build models that work for them. And so the general youth mental health core model will have lots of space within it for folks to be really specific. And then also with each specific organization, program, potential subgrantee, we work with them really closely on thinking about, how to translate it into AmeriCorps speak. So as alum, I'm sure you're familiar with, there's a lot of, there's a journey of taking something from community program to AmeriCorps program. And so we work really closely with folks to consider all the different nuances, right? Of like how to support that process. And then I think within the Youth Mental Health Core, also broadly, we're really hoping that there's a lot of crossover of information sharing, that part of why a program or initiative like this is important is that it brings people together. So right now there's a lot of really amazing work that's being done on the behavioral health and mental health workforce, but a lot of it is being done separately, right? And so we're hoping that through initiatives like this, we can start bringing folks together, not to say that everybody needs to lose their individual focus, but more to say, let's get more, information shared across streams. And so that hopefully that rising tide lifts all boats kind of mentality will help all these specific initiatives kind of benefit from the increased attention overall.
And Annalise, I would say that, obviously one approach is finding organizations who would be AmeriCorps sites that specifically serve those audiences. But also one of the things that Schultz and Pinterest are doing is they're investing in a national resource system, information and training for the AmeriCorps member to train them to be more broadly construed in their service so that they can address a broader array of issues that they could confront in their services as AmeriCorps members. And so the training for the member to be prepared to serve broad audiences, and then also recruiting the kind of organizations that have direct service to target audiences, I think are the two ways that we'll continue to do that. I did notice, Annalise, that Lisa had a question in the text. Do we have data on the success of this program that has been launched in other states? So you want to talk a little bit about, we've got, I think, 3 states that are operating this year.
Yeah, that's a great question, Lisa. So this is the first year of the Youth Mental Health Corps. 7 states, like Virginia, received a planning grant to design the Youth Mental Health Corps model, and 4 states got implementation funding to really help support this program on the ground. They had existing programs that they were able to evolve into Youth Mental Health Corps programs. And so this year is going to be the first year where there's kind of programs in operation. I will say that this is building off of 30 years of experience with AmeriCorps programs. And so we know the return on investment of AmeriCorps programs generally is immense, or is great. There's, I want to say, I can send more information. I won't make up numbers, but the return on investment is way over $10. I think it's normally closer to $20 or $30 per dollar invested in the programming. And so we know that the benefits and the ability to leverage these resources is out there and is proven. And we're really looking at kind of the ways the near peer model can make it more specific. Oftentimes we look at AmeriCorps programming without upper age limits. And so there's a lot of intergenerational kind of impact that we've been able to see, but now we're really also looking at more specifically how to measure that near peer model and the impact of having AmeriCorps members that are close in age to the folks that they're serving, and seeing, we're optimistic about the potential based off of our experience, but we're looking at gathering some more evidence-based research behind that. It's a great question.
Hey, Kathy, can you do anything about Annalise's enthusiasm gap for this program? I mean,
I was going to say, yeah, lots of folks on this call can attest. If you're willing to have a one-on-one call, I'd be happy to chat about all the specifics and all of the things. And so, you know, that would be one of, I think, the follow-ups of, if anything in here has been interesting, whether it's youth mental health specific, or you maybe have a different community need that you'd like to apply a program model like this, we'd be happy to chat with you one-on-one, or I'd be happy to chat with you one-on-one about, yeah, how to make this a reality in your community within Youth Mental Health Corps or outside of it. We're always happy to help, and I can throw my email in the chat.
And I would also say, just in close, you know, my thought on that is, you know, we're putting this model together for leveraging AmeriCorps funding, but we recognize that the AmeriCorps model may not work everywhere. And so in conceiving this model and developing it for application in Virginia, we want it to be replicable based on regional considerations that may or may not choose to use the AmeriCorps resource to make it happen. And so there's really a broad sense of, we want to design something that has value and merit and can be applied with or without the AmeriCorps funding to be leveraged. So just want to say that too, because you're all looking at ways to lift up programs. If we can come up with a model that is broad enough to have application with or without the AmeriCorps resource, then we're all for that as well.
And I'd love to chat with you, perhaps offline, Annalise, just about, again, the training, the sensitivity and the gravity of mental health challenges that youth face, and doing peer-to-peer, that, you know, there takes some real savvy and expertise in handling even the confidentiality. And I know that's a given, but these are heavy matters that can have life or death implications without being dramatic, folks. And having had a child who had to have mental health counseling over a long period of time, that connection with your mentor, your counselor, is critical, right? And so this is a very serious endeavor, and yet the potential, because it's peer-to-peer and because it's youth, supporting youth, is great. I just would love to know more about the training modules and the screening process, but that's not the time for this discussion. It's an amazing idea that obviously has to be approached with sensitivity. And
And I think it's a great point. And I think that part of what we're hoping this can do is increase access to trainings like that, and to really having standardized expectations across the board to help organizations and in support of kind of their programming on the ground. Having worked for community organizations in the past, it can be really daunting to think like, I know the population I'm serving, would benefit from youth mental health support, and kind of not knowing where to start. And so for organizations that have that deep experience, bringing them into conversation with organizations that are new to this work, we hope is going to have a really rich impact for communities across the state, and can really help address a lot of those concerns that folks might have that might even prevent them from looking into youth mental health work in the first place. And so really making it a practical solution, while also kind of having a real consideration for the nuances of a program like this are important to us.
Yeah, there's some organizations out there doing amazing mental health
Absolutely.
support and counseling, and I just think bringing in the best practices and using that as a norm and a standard will be critical to ensuring the greatest impact.
Absolutely.
It's a given. So yeah.
No, but it's a given, but it's good to share. And I think it's always good to keep as a part of our core values in a programming like this. Any other thoughts, comments, questions? These have been awesome questions. Looking forward to chatting with folks as well, if any of this has sparked anything offline for you or for your organization.
Thank you. Well, I just wanted to say thank you so much. This was such a wonderful conversation, and I'm looking forward, and I know Patty and Angie and Robin too are all looking forward to seeing the next steps, and how VFN can be a support to bring people together and connect to more information. So we very much appreciate our colleagues at Serve Virginia for a number of reasons. And thank you for spending an hour of your time this afternoon on a very important
Thank you for
topic.
creating this opportunity. This is great knowledge.